Hi, this is Dr. Stephanie Wautier, and I'm the host of Conversations with a Chiropractor. This is not a health how-to, but rather a conversation with some amazing people I've had the pleasure of being with on my journey of life. Think of it more like Tuesdays with Maury, a fireside chat, or chicken soup for the soul. Grab a cup of coffee, sit back, and enjoy this conversation with a chiropractor. Kim, thank you so much for being on Conversations with a Chiropractor.
You're welcome.
So to introduce you to everyone listening, Kim, you are a craniosacral therapist, and you and I met 17 years ago when my son Noah had a traumatic birth, and everyone in the community said, you need to see Kim. So what would you tell our listeners about what craniosacral therapy is?
It's very hard to explain, but I will do my best. So cranial is the head, and sacral is the tailbone. So craniosacral works with all of the fluids from the head, inside the head, and all the way down to the sacrum. So there's a tube in the body that is called the dural tube, which is along the spine, and that pumps cerebral spinal fluid through the body and bathes the brain. So craniosacral therapy helps to move and shift that cerebral spinal fluid through a series of techniques in the cranium, in the head, to help that cerebral spinal fluid flow more freely and free up that dural tube of that spine so that your body can self-correct more easily. And that's just a very brief description. It goes way back to the 1800s when osteopaths had cranial osteopathy. And their belief was that the bones of the skull shift and move, and that everything shifts and moves in the body. And so they developed cranial osteopathy to help with the whole head and cranium, which would shake down through the whole body, the spine, and all through the connective tissue. So that was a pretty significant medical model back then, but they had to spend half hour or 45 minutes with people. And then when medicine changed and medical doctors, the MDs came, people didn't spend as much time. And so cranial osteopathy kind of went in the wayside. Then Dr. John Upledger, in the early 70s, took a class, and he was helping a surgeon do a spinal surgery. He felt this pulse in that dural tube of the spine as he was holding that, and he remembered hearing in his class about the cerebral spinal fluid. So he researched and became fascinated and developed and coined the name craniosacral therapy. And he actually studied at Michigan State University. He did many studies, many tests, and was amazed at how when that cerebral spinal fluid and the pulse of the cranial system is full and strong, that the body self-corrects. And he had patient after patient that he helped. And he was a rebel. He didn't want to do all the studies. He just wanted to do the work. And of course, some people rejected his work. And so he said, I'm going to teach as many healthcare professionals as I can this work because it's working. And so he worked with babies and elders. He taught teachers. He taught dentists and physical therapists and massage therapists and nurses and doctors and osteopaths, anybody that had a healthcare professional degree or certification. He said, we just have to get this out into the world. So that's how it all started. And it is very gentle touch. You go way, way, way underneath the defense mechanism of the body. The touch is 5 to 10 grams of pressure. So it's like a nickel on your skin. And The way that makes sense is if you think about when there's a boat in the water and you push that boat with your finger, what happens to that boat? So there's this fluid world that we live in, that we are 75% water. And so when you do just a little bit of movement, everything can shift. And so that's the image sometimes I tell my clients. Or the other great image is if you have a leaf that's on the water and you want to move that leaf and you want to slide that leaf, you can't push down too hard. You have to go very soft. And so that works with the membrane systems of the body, and it works with the connective tissue, which is called the fascia. And so the membrane system is sometimes gets torqued inside the head. And so when we encourage those bones to go back into alignment, then what happens is that membrane system shifts, and then the cerebrospinal fluid can flow more easily.
I absolutely love the way that you described that. Sometimes it's hard to describe the work that we do. You know, if I'm going to say chiropractic is moving bones, but there's so much more depth and there's so much more complexity to that healing process. So you and Kelly Griffin have a podcast called Yooper Wisdom, and you were talking about working with babies with colic. I work with a lot of babies with colic, and I usually tell the parents bringing them in that what I'm going to do as a chiropractor is clear the structure of their spine all the way up through that first cervical vertebrae in their neck, but they need probably to have more work done, and I send them to you. I send them for cranial work because my son's distorted facial features and structure, if we can physically see on the outside how someone, a child especially, is physically distorted, can we even fathom the depths of the distortion within that fascia, that connective tissue, the tendons, the bones, the blood vessels, the nerves? Like, when we are in a state of dis-ease or less than optimal functioning, it's affecting everything. You talked a little bit about the vagus nerve and the cranial nerves. Do you want to touch on that a little bit?
And one of the things that you mentioned is the babies. And this is why Dr. Stephanie and I like to work on babies so much, because if you can help them correct any little issues that are going on, it can affect them for the rest of their lives. And we've had experiences like this where maybe a baby is stuck in a position in the womb and their muscles are twisted a little bit and they come out, and you think of a baby as just being, oh, they're okay, but maybe they have a little torsion in their muscles, which goes up into the neck, which goes up into the head. And so if we can unwind that and work with that on a musculoskeletal level, then that baby releases that, boom, just like that, and they have relief, and then everything can develop so much more quickly. And we work with motor skill issues, and the colic is fascinating. I remember the first time I worked on a baby with colic, and mom was distraught, as all moms are with colic, and baby was distraught. I said, I just took this class. Can I work on your baby for 10 minutes? And she said, sure. She was just desperate. So I did. I worked on her little girl for maybe about 10 minutes. I think she was about 3 months old, maybe 2 months old. And she never had colic again. That doesn't happen every time, but what happens, and this will make total sense to the listeners, if I can explain it right, and that is that, so you have your nerves going down your spine, and we all know about those nerves. We also have 12 pair of cranial nerves that are so important, they're buried inside the head, inside the lower part of the brain, right? They're protected. And those nerves have to do with eye movement and mouth movement and tongue movement and hearing and facial expression and digestion and heart rate, right? So those nerves are vital. And if that skull gets turned or torqued, or the membranes inside get turned or torqued, then it can put pressure on those nerves. So one of the colic issues is the vagus nerve, which is one of the bigger cranial nerves. And that nerve is responsible for digestion, right? So here's a baby in the womb, and they come out, and they might come out naturally, or they might be vacuumed out, or they might be, have a cesarean or have some trouble. And so all those bones get squashed, as we know. That's why there's that soft spot up there on the top of the head. All those cranial bones are all loose when we're born. It takes 1.5 years for them to start to firm up a little bit. But anyway, so here's this baby, and maybe their vagus nerve has been compromised from the pull of pulling them out of the birth canal, or some kind of situation where those nerves have been compromised, and then there's the digestive issue right there. Mm-hmm. And so to free that up, which is just a very minor technique, helps to free up cranial nerve, the vagus nerve, and then they don't have the digestive issues anymore.
And it's life-changing. When you've got a baby who's colicky and crying, and mom just wants that baby to feel peaceful and for everybody to rest, it is so powerful. And what's interesting about chiropractic, so many people think, oh my gosh, baby, their bones aren't even ossified, and you're going to take their neck and twist it and jam it and crack it and crunch it. I always encourage parents not to worry, because I do light work in the chiropractic world. And if we imagine that lightness and that nuance touch of your hands as a craniosacral therapist, it is such light, powerful, beautiful work. I remember you working on me, then I became your patient after Noah, and I wouldn't have even said that I had any issues, but what I physically felt, or what I visualized was happening, if you punched the side of an aluminum can and it was indented, and then like light air pushed it out and popped it back out, I literally felt like that was what the entire side of my face did. Now, I'm not going to be eloquent and say exactly what happened in that, but I have felt, even as a patient, how powerful cranial work is. And we've talked about any conditions, like chiropractic isn't the end-all be-all, just eating organic food isn't the end-all be-all. We need a team of health care / bodywork providers to successfully bring people up to their fullest functioning potential.
We go to the dentist, and we go to the doctor, and we go to the maybe physical trainer, and we go to the stores for our clothes. We have a team for our physical bodies on many levels. So this is just a preventative healthcare team where, if you go to your chiropractor and you go to your massage therapist or craniosacral therapist or acupuncturist, and you get involved in that, then hopefully you don't have those big issues later on. My husband's so cute. He'll say, how does anybody not get chiropractic and massage? How do they live their life and not get that? Why isn't this part of the healthcare system? And we're getting better. When I first started, people would still give an odd look with massage, and they still give an odd look with craniosacral, because they're probably craniosacral therapists that are certified. There's probably only, I don't know, I'm guessing 8,000 or 9,000 in the world right now. So yeah, there are very few of us that are actually certified in cranial through the Upledger Institute, through Dr. Upledger.
Kim, would you say that most of those 8,000 or 9,000 practitioners who are certified under Upledger, are they mostly people who have started their training as a massage therapist? Or like you said, Upledger just wanted any profession, any healing arts? So would those people be in very diverse healthcare categories?
Yes, diverse healthcare. Many physical therapists are very involved in craniosacral therapy right now. But yes, in some of the seminars that I've attended, there are dentists, counselors, midwives, nurses, MDs, chiropractors, just such a big variety of people that take craniosacral therapy. Not very many people that practice do like pure craniosacral therapy. They may combine it with other modalities or techniques that they have. For me, I have always just wanted to do a pure 1 hour craniosacral therapy session, because I feel like that is, for me, the results that I've seen are the most powerful that way, instead of combining it with other things.
Yeah. And you really have to have such, like, your intention is so pure. Your focus is like laser focused when you are working on someone. That atmosphere that you have, and that is what is so healing. It's truly amazing.
Yeah. The whole environment is soft and safe and gentle, and then I just get out of the way. I just don't have an agenda for people because their own inner being, their own inner physician is really the one in charge. So I just step back, I blend and meld with them as best I can, and then listen to what their body is telling me, just like you do, and go about doing certain techniques to help to find that self-correction and that relief. So many times people will sigh or take a really deep breath or yawn, or there's all these different indicators that us as people in the healthcare, preventative healthcare, alternative healthcare, we notice. And so that kind of guides us too. It's fascinating.
It is fascinating. So remind me how long you have been in the healing arts.
Thousands of lifetimes. But in this lifetime, when I was 21, I graduated with a degree in counseling. So that's part of the healing arts. And then actually 33 years as a massage therapist and craniosacral. And I practiced craniosacral for a long time. I didn't really become certified, but then I got antsy and wanted to do something significant for myself. So then I just got certified in it, and it was intense. It's an intense program.
So as you and I talk about like different phases of our journeys of careers and life, several years ago, you came out with a book, and that book is available in a lot of local shops. And tell us a little bit about how you came to put that book together and what it was called.
Okay, it's a fun story. I go up to our remote cabin, and there's no electricity. It's off grid, and you get really quiet, and nature is predominant. So I started writing nature stories up there. And so that got me thinking about the Upper Peninsula and how amazing and how fortunate we all are to live up here. And so one day I was at my office in town, and it was a snowstorm, and I was looking out the window, and all these trucks were going by. All these trucks are going by, and they're all women driving them, one after the other, these big old trucks in the snowstorm. And I thought, what makes us women really want to live here? Like, we're different. There's not very many women in this country or the world that would volunteer to drive a truck in a snowstorm up in the remote woods. So then I thought, I'm going to have bonfires because it's fun, and party bonfires are really fun, and we'll just do the interviews around bonfires. So for a couple of years, we did interviews around bonfires of why women want to live in the UP, what their story is and their history. And then I sprinkled in some really sassy things in there, and also some nature stories that touched my heart. And I came up with Yooper Wisdom, or Yooper Women, Guts, Grit, and Grace, which I think we all have. And that book is actually on its second printing, and it's available at Michigan Made and Seiche on 3rd Street in Marquette, and Rewild in Marquette right now, and also in Newberry and various places in the UP. But it's a fun, different book. It's not one that you read from cover to cover. You can just pick it up and read it whenever. And it's great around the bonfire for camping.
So this book comes out and you have all the success, and now you have started this Yooper Wisdom podcast, which, I mean, you could talk about, but I also want you to tie in now what you're going to be doing in the future with the Yooper Wisdom television show.
Right. So one of my clients said to me, Kim, you got so much wisdom, you need to put it out there, just not one-on-one. And I knew she was right, but I was chicken. And so anyway, I had this woman that I met she read my book, and she's a film producer. And so she said, let's do a film. We got together and we did a documentary short film, and it actually was at the Fresh Coast Film Festival, and that was shown at that time. So anyway, we showed the film at the Fresh Coast Film Festival, and actually it was shown all over the country and Hawaii and Toronto and Chicago and I think Detroit. And so that was really exciting. And while the film was being shown, PBS came up and said, would you be interested in doing a series, to the producer, Kelly Wolf Griffith. And she has Wolf Vision Productions is the name of her company. And so she asked me, and I said, why not? But we want to link it to healing, and we want to link it to a significant thing. And so we decided that we would take an initiate, we're calling him an initiate, a participant, not from here, and maybe somebody from the city, but somebody that's not scared to death of the woods, and take them out into the deep forest in a secret location and have 4 of us Yooper Wisdom keepers who all are in the healing arts, who all have deep knowledge about spirituality and nature, and immerse them in this situation and see how they transform. If they're having any issues, if they're depressed, or if they're stuck, or if they've had trauma or grief. Kelly's going to do a whole casting on that, and we'll find the right person and then take them into the woods and do some ceremonies, some drumming, some meditation, maybe some yoga, hiking and kayaking, and educating about the
Thank you for listening to part 1 of this conversation with Kim. Kim will be back on Conversations with a Chiropractor soon. Subscribe to the show so that you never miss an update.
It was such an honor to sit down and talk to Kim Kee, who I've known for so many years as a clinician and as a friend. And now she is delving into being not only a podcaster, but also a movie star. And soon she is going to have her own PBS series. So look out for this amazing team of women that includes my friend Kim Kee. Check it out, Yooper Wisdom Podcasts, and everything is produced by Wolf Vision Productions.